Surveillance really helps us follow things, including treatment, in absolutely real time, because if somebody has done something, besides for just track the disease, but if somebody's actually done an intervention, treated a number of patients and had a success or had a failure, that goes out to the world on various modalities very, very quickly in real time. GeoSentinel is a global surveillance system with the unique aspect that we only look at travelers. We do not look at diseases in local populations. We look at travelers who travel out somewhere and come back to their country of origin. Although the H1N1 flu is a fairly mild, there have been deaths of course, but it's fairly mild compared to a lot of other novel flus, it does seem to be a whole lot more contagious. And because of that, it seems to have spread more easily. So, back in 1918 and 1919, when we had the Great Flu epidemic, it took, and that was a more severe epidemic, but it took 6 months or more for it to spread across the world. And basically, this spread across the world in 6 weeks. And you had, clearly it started in Mexico and the United States, and within 6 weeks, it was in basically every country in the world. Right now, the major risk groups for severe disease and death are the younger people, pregnant women, compromised hosts, or people with some significant underlying disease. 2/3 of the cases so far, and this has been holding up all along, 2/3 of the cases are in people under the age of 25. Only 10% of cases are in people over 50. So this one is really unique in that the complications and the severe disease seems to be occurring mostly in younger people without pre-existing immunity. And so the highest risk groups are definitely very young children and even school-age children. We don't believe that screening travelers arriving in a country is that beneficial. We don't believe that closing a border is that beneficial, but it certainly lets local authorities, say in Spain, know that there are certain countries where travelers are arriving from. Those flights may be more at risk of carrying somebody that may transmit the flu.